Welcome to Thursday's edition of COVID-19. It is the last day of the year 2020 and quite a number of countries are ending the year with infection numbers and death tolls hitting record highs. Healthcare workers nonetheless are devoting their efforts on providing effective treatment while policymakers are seeking effective measures to better contain the latest situation. I have Kwon So-ah standing by now with the broader pandemic coverage. So let's begin here in Korea, where the daily tally has marked a slight decline here.
Right, Sunny. So we're ending the year with maybe a little bit of hope in our minds as we have less than 1,000 cases confirmed this Thursday. To be exact, 967, out of which 940 were domestic transmissions. But with that figure added, South Korea has now surpassed the 60,000 mark in total cases on this last day of 2020. And also, if we take a look at the details here, the country has hit 900 deaths in total, with 21 added in the span of a day. And out of the 17,569 people that are currently under treatment or under quarantine, 344 that is, are in serious or critical condition. And many of those patients were infected with this disease at nursing hospitals and nursing homes, and cluster infections related to such medical facilities also broke out this Thursday in the capital Seoul and Gyeonggi-do province, which are still seeing triple-digit figures of daily infections. And Busan, which had the third highest number of cases this Thursday at 74, also had new infections linked to medical facilities such as nursing homes. So the figures still look grim. So New Year's Eve and New Year's Day won't be the same as in past years this year, with stringent social distancing measures still in place. But the government is determined to improve the situation as fast as possible.
The government will do its best in 2021 to bring an end to the COVID-19 outbreak and turn over a new leaf. We can all go back to our normal lives more quickly if you can stay with us and be strong.
So let's do hope that the figures will look different in 2021 and will not look like these figures we are seeing here, which meet the criteria for level 3 social distancing measures. Speaking of which, the government is expected to make an announcement whether the current levels 2 or 2.5 in the metropolitan region will be extended or maybe even raised.
I see. And so on a slightly brighter note, I hear there has been some progress on the local vaccine front.
Right, Sunny. Following a number of contracts with foreign vaccine products, Prime Minister Chung Se-kyun said this Thursday that locally made vaccines are expected to be introduced around the end of next year. And Chung also reiterated that the first imported doses will be administered as early as February. And the first shots Koreans are expected to receive will happen to be Britain's AstraZeneca, which just recently on Wednesday local time has been approved by the UK government. And speaking of the UK, let's take a look at the figures here in the UK. Again, for the second straight day, over 50,000 infections here, despite vaccination progress because of the COVID-19 variant here. And the same problem South Africa is dealing with over 17,700 new infections. And the US had a decline yesterday, but now we're seeing almost 240,000 new cases. With that, the US has a total of 20.2 million, followed by 10.2 million in India. And it's not only European countries that are seeing resurgences as well as the ones that I just named, but also Latin American countries. These Colombia, Argentina, and Mexico are now seeing, again, more than 10,000 cases on a daily basis. Now, with 1 year passed since the WHO has confirmed the first COVID-19 case, now the world has accumulated 83 million infections. And those are the updates I have for now, but I'll see you in a bit after the government briefing. Sunny?
All right, so thank you for that. Back on the local front, a turbulent year is drawing to an end, and we mark its closure with a trip to a meaningful place amid hopes for more productive cross-border exchanges in the new year. I have Chun Song-cho up next. Hello, Song-cho.
Good afternoon, Sunny.
As always, Song-cho, do start by telling us where you are.
Yes, I'm on the observatory deck at Imjin-gak near the demilitarized zone, or the DMZ, dividing the two Koreas in the border city of Paju, which is just an hour drive northwest of Seoul. The reason why I came here on New Year's Eve, the last day of 2020, is because this year hasn't exactly been an exciting one in terms of inter-Korean relations. Well, the optimistic outlook following the re-establishment of the inter-Korean symmetry back in 2018 ended up short-lived, and some are even wondering now if things are back to square one between the two Koreas amid a stalemate in peace talks. And visiting a place like Imjin-gak really gives you a perspective of how close yet distant North Korea is to South Korea. If you see a bridge over there, and beyond that bridge literally lies North Korea. It's not even 10 kilometers away from where we're standing right now. And if we look around the Pyeonghanuri Park here at Imjin-gak, and then you can also see remnants of war, like damaged old bridge, newly built bridge to DMZ, and heavily damaged armor locomotive, and of course, the barbed fences stretching as far as you can see. And so it really gives you a perspective of how North Korea is very close, yet far away from South Korea. This place usually gets really crowded and packed with tourists, but with the current mercury level hovering far below freezing right now, and also the third wave of COVID-19 infections in full swing in the nation, there's nothing but stillness and silence in the air right now. Well, it's really hard to imagine and see what's going on inside the reclusive regime, but Pyongyang is also said to be on high alert against the new variant, a highly contagious strain of coronavirus that's spreading rapidly across the world, including South Korea. And Pyongyang has also imposed the highest level of emergency measures, including the suspending the operation of public facilities and tightening regulation of sea entry, and also restricting the movement of people inside the capital as it prepares for a massive ruling Workers' Party Congress next month inside the capital. And the South Korean government has offered a helping hand to the North in combating the pandemic recently, but we have yet to see and hear any response from Pyongyang so far. Well, people say when you face a crisis, you know who your true friends are. Well, and 2021 marks a new beginning, new year. So hopefully in the new year, 2021, the two Koreas will be able to set their problems and past aside and really focus on weathering the pandemic together. This has been Chun Sung-cho reporting live from Imjin-gak, and back to you guys in the studio.
All right, Sung-cho, thank you for braving the cold weather to bring us that report. Right, up next, we are poised to join the regular afternoon briefing on COVID-19 here in Korea for this Thursday. And while we wait for that to commence, here are a few reminders about some of the prevention measures that are in effect nationwide until the 3rd of January next year, which would be this coming Sunday. Social gatherings of 5 or more people are banned in the metropolitan region, while they are strongly discouraged in the rest of the country. Restaurants nationwide, meanwhile, cannot accommodate groups of 5 or more diners. The exception to this regulation includes those who live together as registered in their official documents, meaning a family of 5 or more who are registered under the same residential address can dine together. Also, an exception to the restriction on gatherings is that related to business, as well as weddings and funerals, where the cap on attendance stands at 49 or fewer, but 29 for funerals here in capital Seoul. Also, universities face a limit with regard to testings for new applicants, with 49 or fewer allowed at any one venue. All ski resorts have been closed, as have all tourist destinations nationwide. The closure comes in light of efforts to discourage the gatherings of large crowds that pose the risk of cluster infections. Meanwhile, reservations at hotels and other accommodations nationwide face a capacity limit of 50%. Right, now we have just heard that the briefing has been delayed by about 5 minutes. So for now, we are going to take a look at the global interest in Korea's initial response to the pandemic from the point of view of our foreign press. Do take a look.
Korea's COVID-19 containment strategy, dubbed K-Quarantine, got a healthy dose of the foreign media spotlight in 2020. In their reports, the foreign press universally praised the transparent disclosure of information by the Korean government. The high level of civic participation that made it all possible was also a subject of great interest.
The tracing system that was already in place was impressive and got even better. And then that, of course, with transparency in the sense that how government was communicating very clearly with the population, and also the kind of data information that the government was making available for people to understand how this pandemic works.
Korea's early and mass testing efforts were also met with plaudits from the foreign press. In the early days of the pandemic, Korea's private sector reacted quickly to roll out new test kits, which were quickly approved by the government for emergency use. This allowed Korea to carry out screenings faster and on a wider scale compared to many of its peers.
I think what Korea managed to do is get up a quick testing, isolation, quarantine regime in place. So that was really quick. Your testing is world class, is world standard. You have a great testing regime.
Korean-made test kits were shipped to many countries across the world, and Korea also became a fountain of new innovative ideas, such as drive-through and walk-in screening centers. At the onset of the pandemic, many countries were thrown into turmoil as governments imposed lockdowns and panic-stricken citizens raided store shelves. However, Korea remained the exception as no lockdowns were issued and social order was maintained. The foreign press credited the Korean people and their high level of civic awareness for averting a crisis that was seen in other countries.
Well, I think the South Korean public has reacted really responsibly to the government's measures to try to contain the coronavirus. When I go out, almost everybody is wearing masks, and when I go into a business, their temperatures are taken, people are registering with the QR codes on their phones, and or registering and writing their name and phone number down in a logbook.
However, the latest resurgence in COVID-19 has thrown up fresh challenges for many countries across the globe, including Korea. The foreign press is also keeping a wary eye on the rising number of COVID-19 patients here in Korea.
This probably is going to be the real challenge for the whole Korean tracing and prevention system. But I'm pretty much sure that somewhere or another, Korean will overcome this until vaccines are finally rolling out and we're seeing most of the population becoming immune to this disease.
The eyes of the foreign press and the world are on Korea as it looks to overcome this latest crisis.
Right, that was the view of the foreign press with regard to Korea's containment efforts. The briefing has started. We'll come back to you afterwards.
Let us begin our regular briefing for today, December 31st. As of today midnight, we have 940 new local infections and 27 new imported cases. The total caseload now stands at 60,740. Yesterday, we had a total of 54,000 people who have been tested with symptoms, and at the temporary testing centers in the metropolitan area, there were over 40,000 tests conducted, and a total of 95,000 tests were conducted during the day, and we have 967 people being testing positive. And currently, we have 17,569 people in quarantine, while 344 are in with critical conditions. We had 21 additional fatalities. The death toll now stands at 900, and the fatality rate stands at 1.48%. And I extend my deepest condolences to the deceased and the members of the bereaved families. And here are some major updates on our local infections. However, today we would not go into depth, and please refer to your press kit for detailed information. And we would like to note that the quarantine authorities believe that we are seeing a COVID-19 outbreak. However, we would like to go over the COVID-19 outbreak for the year as well. And in January, we had the COVID-19 response scheme. And on the 20th of January, we identified the first case of the COVID-19 cases. And as of today, midnight, we have a total of 60,740, and out of every 1 million, we have 119 cases. And we also have identified that 68% were in their age group of 20s, and also below the age of 19, there were about 9.4% of the patients as well. And we have seen a highest proportion of the patients in their ages over 80, followed by those in the 60s. And also we had a high ratio of those people in their 70s and 50s, meaning that there are a higher proportion of patients who are senior citizens. And by regions, about 59%, that is, are from the metropolitan area, and about 30% are from the non-metropolitan area as well. And we also have many cases being detected at the entry points as well. And as for the patients, the ratio of patients for every 100,000, we have had a high rate of proportion of patients in Seoul, Gyeonggi, Incheon, as well as Gangwon as well. And as for the cluster infections, we have seen that about 25% were about cluster infections, and about 26% were related to contact with the previous cases, and about 9.1% were about 5,000 people have been infected through the nursing hospitals. And moreover, we had about 8.7% stemming from the Sincheonji cluster infection, and also 17.8% were related to sporadic cluster infections, and about 9.5% or about 5,000 were also in relation to imported cases. And as for the sources of infection by age group, we have identified that most of the people aged 60 and above were related to cluster infections stemming from a nursing hospital, and also many of the people in their 50s and 40s were in relation to Sincheonji as well as office spaces, and also those under the age group of 19. We mostly saw the educational facilities as well as family gatherings, and also education facilities were also highly spotted among various age groups. And also we have identified that families, also colleagues and acquaintances were the major sources of the local infections, and also above and below the age of 19 or over the age of 16, they had the highest contacts with the family members being the major source of infection. And next, we would like to tell you in detail about the fatality. And as of the December 31st, we have marked a total of 900 fatalities, and the fatality rate now stands at 1.48%. This means that about 1.4 deaths per every 100,000 people, and we have seen that about 480 people were above the age group of 80, and about 250 who were over the age of 70 as well. And also in their 50s, we also have 630 fatalities, and 7 in the age group of 40, and also followed by those in their 30s as well. And as for the age group, we have seen the highest proportion of the fatality rate at about 25.9%, and this is also similar with the fatality rate by age group. And by region, we have seen about 253 cases in Gyeonggi-do province, and about 160 in Gyeongbuk area, and about 40 in Busan city. And also we have seen Daegu Gyeongbuk region had the highest proportion of fatalities for every 100,000 people, followed by Gyeonggi, Incheon, and Busan as well. And as for the sources of infection by these fatalities, we have about 409, about 40% stemming from the nursing hospitals and long-term care centers, and also followed by about 15% of clustered local infections. And the contacts with the previous confirmed cases hovered around 9.3% of all these fatalities. And by periods by timeline of our outbreak, we can divide the following into 5 areas. And this starts from the January up to about February, when we had the major sources of infection being from China, and we had about S and V virus type spreading throughout the nation. And the second phase was about from 12th of February to about May 5th, and they were in relation to the Shincheonji in the Daegu and Gyeongbuk region, and we were able to carry out massive testing and contain the virus, and we had a high proportion of people testing positive in their young age group, and the main strains were S and V as well. And the third phase was about May to August, and in early May we had the cluster infections stemming from logistics centers and clubs, and we had major cluster infections in the metropolitan area, and we also find out that most of the cases were GH strain. And the fourth was also in relation to April, where we saw the cluster infections stemming from religious facilities, including the Sarangjeil Church, and also the August demonstrations as well. And we had a very high portion of patients stem in the senior citizens, and we had a high increase of the fatality rate as well. And the major sources or major strain was a GH virus. And the fifth period is starting from the early November to the current status, and this has also seen a rapid spread of the surge in the daily infections from about 100 to now about 1,000. And we have seen many silent spreaders, as well as easing of social distancing measures, which have created more people coming into contact with others, and also colder weather that has factored in as also the major source of infection. And right now we are going through a third major outbreak, a massive wave right now, and we are seeing many cluster infections, especially in the metropolitan area, stemming from public spaces, as well as religious centers, office spaces, nursing homes, long-term care centers, and so forth. And we also have a large increase of those who are with critical conditions. And the OECD member states have identified the following analysis. And in Korea, we have also identified that 100 out of 100,000, we have about 100 cases and about 1.5 fatalities for every 100,000. And this is also a very lower level of infections, followed by Australia and New Zealand. And the quarantine authorities are currently carrying out 3 key schemes in our quarantine measures, which can stand at test, tracing, and treating. And we are also exerting our full efforts to contain the further spread of the virus. And we are also monitoring having an eye on the new variant of the COVID-19, and also we are exerting our full efforts to have a full control over imported cases as well. And in 2021, we aimed to contain and have full control of our third wave. And with the vaccinations of COVID-19 vaccines, we would also like to see a decline in the number of cases, and we would also inject more therapies and treatment for the patients as well. And starting from tomorrow, we will have the year-end and New Year's holidays. And however, we would like to ask you to comply with the following quarantine guidelines. First of all, please do not go on travel or also cancel all of social gatherings, including your meetings with relatives. And also, all of the religious gatherings should be switched to non-face-to-face means as well. And second, regardless of where you are, please wear your face mask at all times. And please also refrain from having group meals and having beverages or smoking in large groups where you have to take off your masks. And third, if you have any suspected symptoms, please get tested as soon as possible. And at health clinics, we ask you to also direct those patients with suspected symptoms of COVID-19 so that they could have testings as soon as possible by visiting the nearby screening center without having another checking procedures there. So we ask for your support. And today is the last day of 2020, and starting from last year on late December, we have also seen the first announcement of identification of the COVID-19 case, and we also see over 83 million cases being confirmed globally, and about 1.8 million have lost their lives so far globally as well. However, Korea has now a total caseload of about 60,740 confirmed cases, with 900 being the death toll. And this is among the lowest level among other OECD member states. And we were able to fight against the COVID-19 thanks to the support given by the public and the medical professionals, as well as the local governments. First of all, the participation by the public were also of the best help in combating the COVID-19, and they also were very helpful in complying with the COVID-19 guidelines as well. So we extend our deepest gratitude to you once again. And second, we also had the dedication and devotion by the medical circles, and despite many difficulties and inconveniences, we were able to contain the virus to a large extent, and we had a low fatality rate right now thanks to a high level of response given by the medical practitioners. So we thank you once again. And third, we had also the major efforts being put in place by local governments as well as quarantine authorities as officials as well. And they were very much helpful in containing the virus until now. And going forward, we will also cooperate with the local governments to contain the virus even further. However, right now we are seeing a major third wave unfolding before our eyes, and we have in front of us mounting challenges and tasks ahead of us as well. We need to extend the number of testings. Also, we need to secure large medical supplies, and we also need to deal with the high-risk groups as well, high-risk facilities, including correctional facilities as well as nursing hospitals and health clinics. Next year, we would begin the inoculation of the COVID-19 vaccines, and we will also have the therapies and drugs being developed against COVID-19. So we would have major changes. And we will also carry out with no delay our inoculation plan for the public. However, even though we have the vaccinations and therapy developed, it will also take some time, a significant amount of time actually, for us and the entire international community to finally overcome COVID-19. And thus, I would like to highlight that wearing a face mask is very important, and social distancing is also very important as well. So we ask for your continued participation and solidarity as well going forward, and the quarantine authorities will also exert our full efforts. Thank you very much.
Right, in our session today, we walk through Korea's campaign against the pandemic that continues even as we speak amid a resurgence that is threatening countries across the world. I have Dr. Yoo Byung-wook from Suncheon University Hospital. Welcome back, Dr. Yoo. And I also have Dr. Alice Hyung-Tan from Ms. Medi Women's Hospital. Good to see you again, Dr. Tan.
Thank you.
Meanwhile, joining our talk virtually is John Power from South China Morning Post. Hello again, John.
Thanks for having me.
Right, Dr. Yoo, let's begin with your thoughts on the world's battle against the pandemic this year.
Well, to human history, we have a big foot against the virus infection. Compared than the 1990 Spanish flu, we couldn't do anything. So more than 45 million victims are happening. But these days we are tracing, we are testing, we are looking forward to having vaccination against the virus as well. So still we are struggling, but probably the human being, we are having the first foot against the virus in the battlefield.
Right, that's good to know. John, I understand you wrote an article comparing the containment efforts of the East and West, John. Do tell us a bit about your findings.
Yeah, well, there has been an interesting dichotomy really between a lot of countries in East Asia in particular and in the West, in Europe and the United States, in terms of how the pandemic has been handled. Of course, Korea is one of a number of examples of countries that have kept cases relatively low and also in many cases sort of kept economic activity fairly strong, along with places like Taiwan, Vietnam, Japan as well, maybe to a lesser extent. And I think this has become an interesting talking point basically among a lot of people about why these paths have diverged so drastically. I mean, it's difficult to boil it down, but there's a lot of potential reasons. I mean, and you've had very impressive public health responses in places like Korea and Taiwan, and also in the case of those two jurisdictions, you've had very sophisticated contact tracing and digital surveillance and things like that. Then there's also just been the question of the public behavior and maybe culture in the eyes of some people, where people seem to have taken it upon themselves to do things like wear face masks, reinforce hygiene standards and things like that. And that seems to have made a difference. I mean, for example, in Hong Kong, cases here for much of 2020 were quite low. And it seems an awful lot of that was to do with the public's experience with SARS. And even before the government started to sort of make pronouncements about what people should be doing, people were very quick to do things like wear face masks. And those messages took a long time to filter down to the UK, the United States, European countries. And even now, after a year, it seems that many of them are still really struggling with the pandemic to an extent that isn't so much the case in East Asia.
Right. Dr. Tan, speaking as a medical professional yourself, what are your thoughts on Korea's early strategy against COVID-19, and what do you suppose made this strategy so effective?
Well, I think you can break down COVID-19 into 4 phases. The first phase, the early phase, was from December 2019 to the spring of 2020. Phase 2 is summer and winter of 2020. Phase 3 is going to be spring of 2021 through the end of vaccination, the first round of vaccination. And phase 4 will be post-vaccination, how we deal with the long-haul COVID-19 patients, and then dealing with COVID-19 as an endemic disease. As you said, I think Korea was successful in dealing with phase 1 of COVID-19. And of course, everyone has talked about the 3 T's: testing, tracing, and treatment. I think the secret to our success was, however, the adaptation of these techniques to the challenges of COVID-19, because these 3 T's, they've been around for decades in terms of infectious disease epidemiology. They're nothing new. They're kind of the bread and butter of what infectious disease specialists have always done to track and control an infectious disease. In terms of the testing, our early recognition for the need of rapid and accurate diagnostics, I think, was key. And then our Korea biotech industry, they really were able to step up and manufacture, develop test kits with the speed and scale that was needed to match the challenge of the outbreak in Daegu and Gyeongsang province. We also developed, of course, very safe and efficient sampling techniques, such as the drive-through testing centers and the reverse booth centers. That made the testing process much safer and more efficient. In terms of tracing, we were able to integrate our IT platforms, so credit cards, CCTV, mobile technology. We were able to integrate all of this so that we could condense the tracing process from days to minutes, and that was essential to deal with the scale of the problem that we had. In terms of treatment, I think our decision to isolate every positive case in a monitored isolation facility was very important, because I'm sure we were able to prevent thousands of home-based infections by implementing this measure. And then lastly, in terms of The fourth T that was not mentioned, transparency. I think this was also critical to our success because different from how we did it in 2015 during MERS, we were very transparent from the beginning about what was going on. The KDCA delivered information that was timely, that was truthful, and this in turn engendered trust in what the government was doing, and of course that promoted compliance from the public, and public participation was really what sealed the success of phase one of COVID-19. And I think that's perhaps a summary of how we dealt with this first phase.
Right. And John, keeping that in mind, do you believe Korea's early handling of the pandemic has perhaps had a positive impact on its global standing?
Well, I think certainly Korea has received a lot of attention and coverage, and a lot of it has been positive, especially in that February-March period where Korea was one of the first countries to sort of be hit very hard and have a major outbreak linked to religious services, and then was able to bring that under control. And of course it did so largely without having to implement very strict lockdown measures, which of course have had pretty serious consequences and have, exacted a human toll. So I think it probably has. And obviously Korea now is dealing with, a large outbreak, 1,000 or so cases a day, and it's facing some challenges there. But I think as well, the thing that's quite interesting for other countries to look at is that Korea has managed to, keep the economy, obviously has taken a big hit, but has managed to keep the economic damage so far to a minimum, which I think is something that's eluded a lot of places. And I think certainly that's something that would be good to learn from. And, if it can keep that intact to some degree, even though cases are spiking, that would be, I think, very welcome for everyone involved.
Yes, it would. Dr. Yu, meanwhile, yesterday, leading infectious disease experts Chung Young and Anthony Fauci held virtual talks regarding the pandemic. What are your thoughts on such exchanges?
Well, these exchanges, they'll be to discuss about the general condition of COVID-19, but I believe especially they discuss on about the vaccination, because now US, they do the vaccination, it started already. In Korea, we have to get some experience and preparation, especially for the two different type of vaccinations for the really started in Korea Peninsula sooner. But also this is kind of good because this had the person have opened the channel for each others. They can share their experience and transparencies. How do you know the both governments? Because U.S. government will change their head persons and their governance. Probably they will turn on the new policies will be put against the COVID-19. Probably we got some the knowledge from them. Also, same time, Korea, we can share our experience to them.
Right. A Biden administration will probably adopt a different policy from the Trump administration. Dr. Tan, separately, President Moon Jae-in and the head of Moderna held talks, Stephen Bancel, this past Monday that is, and they talked about collaborating in R&D research with regard to the messenger RNA technology. Can you tell us a bit about that, please?
Right, so Korea currently has 4 domestic vaccines in production or in development. 2 are DNA vaccines. We have 1 synthetic antigen vaccine and 1 viral vector vaccine. So we do not have an mRNA platform viral vaccine against COVID-19 in our portfolio. So the possibility of technology transfer of mRNA technology from Moderna to Korea is groundbreaking, not just for COVID-19 vaccines, but for the entire pharmaceutical industry here in Korea. Moderna has called the mRNA platform, they call mRNA the software of life. That's what you can think of it that way. And the use of mRNA platforms for the discovery, development, and manufacturing of medicines is really groundbreaking. And so I think if we're able to get this technology, it would really change how we approach the therapeutics of not just COVID-19 and diagnostics, but just for many diseases in the future.
Right. Dr. Tan, despite the earlier praise regarding its containment efforts during phase 1, like you mentioned, Korea, even as we speak, is struggling to tackle a third wave that is raising daily infection numbers and our death toll. Is our strategy of testing, treating, and tracing being rendered futile, perhaps?
Well, those 3 T's, the 4 T's that I talked about, they are still the essentials, but we need a major upgrade. So we need to go not just version 2.0, but version 10.0, because the face of this disease has changed. The landscape has changed, and so we need to evolve with it and take on a different approach. In other words, testing, the disease is no longer localized to one venue, one city. And so we really need to take testing into the community because that's where the disease is. So I love the idea of more preemptive testing, mobile testing, testing on demand. So if there's an organization or an institution that thinks that they need to be tested, they can call, say, the KDCA or the Metropolitan City of Seoul and get a team, a mobile team, to come and test all of their, say, employees or students or residents. I think that's what needs to be done. It needs to be taken into the community. Secondly, in terms of tracing, we've hit beyond 4,000 cases of unknown epidemiological link. That means our tracing capacity has now been overwhelmed. We need to expand our manpower, and also we need an overhaul of the IT infrastructure of our public health system. Amazingly, some of this process is still pen and paper, analog, so we need to really digitalize the process and unify the platforms that are used for the tracing process. In terms of treatment, I know we're using remdesivir, and Celltrion has received a restricted access use for its monoclonal antibody, but Regeneron and Eli Lilly, they have received FDA emergency use approval for their monoclonal antibody techniques. I'd like to see Korea move to get these FDA-approved products into our country so that we can start using them for our patients. And also, there was talk of developing an infectious disease specialty hospital. I think this is long overdue, and if we can consolidate our COVID-19 patients, that will improve the efficiency of care and also decrease the risk of hospital-based spread of COVID-19 in other tertiary care hospitals. And then last but not least, public participation. We have to really call on the Korean people to step up to help us overcome this third wave because it is taking a huge toll on our country.
Right, and staying with that third wave, John, as a person looking into Korea from the outside, what are your thoughts with regard to the latest situation here in Korea?
Well, obviously, it's a concern when you have a big spike, and this seems to be the most sustained and severe outbreak yet in Korea. I mean, at the same time, it's probably worth keeping these things in context. Even now, still, Korea's caseload is much smaller than many countries, as is the death toll. And we'll just have to see how the ramped up measures that the government has been undertaking recently will impact the spread of the disease, and if it will come down in the next few weeks. Obviously, this latest outbreak has, I think, posed a challenge to the Korean response, which looked maybe more secure until now. But even now, I think it would be worth keeping in mind that this is still at a level that is not as catastrophic as many other places.
Right. Dr. Yu, keeping in mind the inoculation campaigns of countries that have been able to secure vaccines, when do you believe will the pandemic come to an end?
Well, there are two scenarios. Like first, the Spanish flu 1990 and 1919, that time just disappeared because the virus get the variants for the survive. Sometimes the messengers and the DNA or RNA signal is out of order. This is disappeared. It's like the SARS coronavirus in 2003. But we have a new variant now, but we don't know still is it going to survive. It's like the MERS coronavirus to going around or not. But we believe that we have new weapons like the vaccines. We have only now 4 and 5, But others, the manufacturers for the pharmacological company, they will make it more in the next years. So which means, so we got it, have a bad experience with H1N1 2009, but now we're having it like just a seasonal flu. So this is two scenarios. COVID-19 turned to be is recognized as like a seasonal COVID with a vaccination live together. Or another better scenario, I hope, like a Spanish flu, is ciao, disappear, and we just memorize of 2020 in our history.
Hopefully that will be the case.
Yes.
Dr. Tan, speaking very briefly, we have a long weekend ahead of us. As Commissioner Chung Young mentioned during her briefing, what are some of the precautions that you would advise members of the public to keep in mind?
The most important is to prevent gatherings. That is really, because that's the way that the virus is spread. And so even though it's tempting to want to meet family, to go and greet family, I would say just let's keep it low-key, keep any sort of interaction online. We don't need to see the sunrise in a big group. We can do it from the comfort of our home on our TV. And that's really the most important. In addition to everything else that we've been doing, keep a mask on. Do not eat and talk at the same time. Finish your meal, talk later with a mask on. And then hand hygiene, of course, ventilation, everything else, all the other non-pharmaceutical measures that we've been doing successfully up until now. We need to continue.
Right. Okay, Dr. Dan, thank you very much for that. Dr. Yu, thank you very much for your insights. And John, over in Hong Kong, thank you for your time as well.
Thank you.
Right, and that brings us to the end of this year's coverage of COVID-19. I hope your closure of this turbulent year is a safe one and your ushering in of the new year is a bright one. Do take care. We will be back on the first Monday of 2021.